Okay, I've got a question. Why is poop green sometimes? I've looked into it a little bit, but everything that I've seen just says it happens if you eat a lot of green foods or food coloring. But sometimes when I don't do that, it's still green. What else can cause this? Green leafy vegetables, food coloring that's in food can do this. Sometimes different medications, iron supplements can do it. Antibiotics could do it because it's changing the bacterial environment within the gut. Also relating to bile. So sometimes people have yellow bile versus green bile. So what happens is, say you have a lot of greasy, fatty foods that you're secreting more bile to help bind to the fats. If you're having diarrhea, what ends up happening is it doesn't have enough time to change color to the brown, and so when it gets excreted out, it changes into like a greenish color. Hey, Dr. Wagner, is there a way to get taller faster? No. What you got is what you got. If you are growing, that means your growth plates are open and they're growing at the normal rate at which your body is going to grow. Your height is what you got. It's genetic, outside of like weird, not conventional surgical procedures. I'm not proud of this question, but I remember having an argument in middle school about whether or not a woman, biologically, could get pregnant by an animal. Though the answer may be obvious, is it possible? No, not really. One, to begin with, there's a massive ethical issue with this question. We're like trying to crossbreed to make these hybrid animal people things, not really appropriate. But say that there's a weird act that occurs. No, typically they haven't actually had this occur. Lab study wise, they have been able to figure out how to like cross like a human and a chimpanzee. They're able to mix the genetic material to have a successful kind of like building blocks of life, but they don't take it further to actually create it because of ethical problems. The issue is, from a scientific level, are they able to grow organs of humans and animals, that sort of thing. But when it comes to like mating and like sperm from one animal to egg of a human being, no, that doesn't make a hybrid horse human or dog human or mouse human, those sorts of things. Are testicular cysts dangerous for you? Should they be removed, or are they safe to keep? This has been a question I've asked my doctor and never got an answer. So there are different types of cysts. So cysts are fluid collections. So within the scrotum, where your testicles are hanging out, you can get a spermatocele, which is a cyst on the epididymis. You can get a hydrocele, which is basically like a cyst or fluid around the testy. You can also get like a hematocele, and you can get varicocele. There's a lot of seals. What ends up happening is usually these are benign. You let them be, you take some anti-inflammatory pain medications, and they will pretty much resolve on their own. If they don't, that's when you typically should go to a urologist who is a specialist in the urogenital system and who's a surgeon. Can you tear a hole in your intestines or stomach if you eat and go to the bathroom at the same time? Is it harmful? Who is eating in the restroom? There's fecal matter all over the place that you don't realize. But the question is, will you tear your intestines or your stomach? No. All right, so if you are sitting there taking a poop and you need to eat that sandwich just because you don't got time, or that's just what you do and you need to try to fill up your stomach more so you can have more poop go into the bowl, don't do that. I would advise not doing it because of sanitary issues, but from a danger issue, no, it's not harmful. Minus the fact that I just don't want anybody eating E. coli that's coming out of their body and continuing the cycle. Can you adjust your bowel movement schedule, i.e. from morning to evening, and how? So yes, you can. It's just habit. Maybe too much information. I get up, I have my coffee, everything starts flowing, I go in the morning. If I do a morning shift too early, I don't have time to, allow things to do their normal function, that doesn't happen. So you can adjust your schedule, but at the beginning, you literally just have to go and pick your time that you want to go and work on sitting there and trying to get your body to relax. Okay, why does your urine turns white does mean drinking water? The issue is, why does my urine turn white, and does it mean it's because I'm drinking a lot of water, maybe? Your urine shouldn't turn white. In my brain, white equals pus, and pus equals infection. Usually related to an STD, typically gonorrhea, chlamydia, that needs to be addressed right away. Maybe you're trying to describe that it's clear, so having clear urine is really good. It means you're very well hydrated. It should be clear. You need to be drinking at least 64 ounces to a gallon of water a day, staying hydrated. I know some people are like, oh my gosh, I can't go to the bathroom that much. I'll be peeing all day. Adjusting how much you're drinking, your body will adjust to, okay? So you won't be peeing 20 times a day. It'll readjust and recalibrate. Summary, white urine, bad, see a doctor. My dad sneezes like 12 plus normally. Most ever counted was 18. How is that possible? Sneezing has to do with irritation relating to the trigeminal nerve, cranial nerve number 5. So it's kind of like a reflex, but yeah, you can sneeze that often. You're trying to get something out or it's irritating, but no, typically not gonna hurt yourself if you're sneezing that often, right? Sometimes people say, bless you after you sneeze because your heart stopped. Maybe, sometimes you can skip. The other issue is people try to stifle sneezes, which be careful stifling sneeze, you can blow out your eardrums, but you worry about barotrauma, so trauma to your ears, messing up your sinuses. And I've said before, when people get fractures to the face, you don't want to stifle a sneeze because you can blow air into your soft tissue of your face, which really hurts. I have a question on my mind. Is it ever safe to drink shower water? Also, do more medical question videos. Shower water. You get water in your mouth every now and then in the shower, it's fine, typically. It depends on your area. It could be treated with like chlorine or types of bleach. Consuming in large quantities probably is not good for you. You also have to think about like bacteria, the water sitting in the pipe, sitting in the water tanks because of hot water as well. It's a different system because most people don't take cold showers. So you just don't know. You don't know the pipes that you have. You don't know the potential that if there could be bacteria coming from the water source to your house. Just be safe. Don't be drinking gallons of water from a shower. Is it okay to masturbate every day? Do I lose fertility by doing so? Okay, good question. There's no like number when it comes to masturbation, okay? Some people go weeks, months, some do it every day, multiple times a day. It only really becomes an issue when it actually interferes with like your normal day-to-day routine. From a physiological standpoint, you're not gonna hurt your fertility, you're not gonna potentially increase your risk of prostate cancer or any other types of cancer. As long as it's not hurting yourself, hurting anybody else, or interfering with your life, have at it. Hey doc, I'm really overweight and try everything to lose weight, but can't seem to ever lose the weight. Should I be concerned and see a doctor? So great question, and we all struggle with weight loss. First, you should have a good relationship with a primary care doctor. That way you know that you can start an exercise plan or change your diet and you know you're starting from a good healthy spot with blood work and that sort of stuff, and that you're monitored. But the simplest thing is calories in versus calories out. That's the way you have to look at it first. So if you have less calories coming into your body versus the amount of your expenditure during the day, you should be losing weight. And the goal is to lose about a pound to a pound and a half, almost 2 pounds per week. Okay, you want to do this slowly. No binge dieting, no specific cleanses are going to make you lose so much weight and keep it off. The issue is we do these things where we want a pill or the quick fix to lower all our weights and lose fat, but a lot of times we get rebounds. So slow and steady over a longer period of time with good nutrition, less calories than going out, but you don't want to go super low because then your body goes into a type of mode where it actually holds on to everything, and a good exercise plan. And if you've tried every single diet out there and you're still having trouble losing weight, there could be an underlying issue that definitely needs to be checked out by a physician. Curious, how long do drugs stay in someone's system? Asking for a friend. Asking for a friend. So medications that a doctor gives you, medications that over the counter, all have different half-lives. They can be processed by our body multiple different ways, and it takes different time. You have a medication's bioavailability, how much of the medicine you're taking is actually being absorbed into your system, and how long the medication takes to break down in our system, which is called the half-life. So medication can take up to 4 hours to break down versus multiple days. The other side, which maybe this person is trying to ask, is illegal substances. So marijuana, cocaine, opiates, heroin, Percocets, all these illegal sort of substances. It depends. Marijuana can stay in your hair for a very long time if you're getting tested that way, versus in your urine could last a couple days, a couple weeks. All different metabolisms of different types of illegal substances as well, just like regular medications. Each medication, prescribed or illegal, has its own concrete metabolism and how long it would actually stay in your system. Dr. Wagner, love your channel. I was going to speak with my doctor about this because it's actually worrying me. But is there a medical reason why why women's breasts could be different sizes. Is this common? Should I be concerned? I'd be remiss to say this is actually quite common. More than 50% of all women have asymmetry between the breasts. So in a nutshell, the most common reasons to have asymmetrical breasts is puberty, hormonal changes, and trauma. So should you be concerned about the asymmetry of your breasts? So if this is something new, it needs to be checked out by your doctor. If this is something you've had your whole life, it's probably less likely to be of concern. Just pay attention to it and make sure that it's not changing. If that's the case, then I would address it with your doctor or your OBGYN. Hey man, random question for you. Not to lie, I am farting more than usual. Should I be worried? Okay, we all fart. We're in the business, we call it flatus, but nobody likes us to say that because it's just a weird word. We get gas in our bodies multiple different ways and reasons. When we're speaking, we swallow air by accident, so that goes into our stomachs and then we have to pass that out. Carbonated beverages also bring gas into our system as well. Also, the foods that we eat are broken down by bacteria that are in our gut, stomachs, intestines. They break down our food. Some of the bacteria mixed with the food that we ingest will produce gas. Should it be of concern? Typically not. I feel bad for your roommates or even your coworkers, but we need to get the gas out of our body. So it is healthy to pass gas and to not hold it into your body. I have to tell you how many people have come into the emergency department that I see that don't pass gas, come with this huge distended abdomens. We do a ton of work to make sure they're okay, CAT scans, and at the end of the day, it's poop and gas. Are energy drinks actually bad for you? Great question. I have a lot of coworkers that pound these drinks all day long. I won't mention your name, Alex. Drinking energy drinks is probably not the best for you. I'll tell you why. So energy drinks give you energy mostly because they have a lot of caffeine in them. They will also add other different amino acids to them to help accentuate the effects, but most of it is caffeine. So some have up to 300 milligrams of caffeine in one can, and people are taking this all the time, all day long. If you're not sensitive to it anymore, may not do that much, but if you're pretty caffeine naive, it will make you feel horrible. Get your blood pressure up, get your heart rate up, called tachycardia, might make you feel like you're gonna pass out. I've even had friends having to go to the hospital because they've had too much caffeine and their heart rate was 150 beats per minute, which is quite uncomfortable and scary and might make you feel like you're gonna pass out, sweat, get lightheaded, and even have nausea and vomiting. So these are things to be careful of. Typically, the effects of an energy drink hit about 20 minutes to 30 minutes later, so just be aware and be careful. And depending on the drink that you're having, could have a lot of sugar. And if they don't have sugar, they have sugar alternatives. Be careful. A lot of sugar will give you energy, but will also give you a crash, which is not good for spiking in your insulin. And you don't want that extra sugar in your body. And be careful of these substitutes as well. So if you're going to have this, try to opt for something that's closer to 100 milligrams of caffeine and doesn't have any sugar. If I swallow gum, does it actually stay inside on your stomach forever? No. Old school myth, I've heard it too. If you swallow gum, it's gonna take 7 years to get out of your body. No. Our body breaks it down just like any other food. It'll probably take just a couple days for our body to process it and get it out of our stomachs into our intestines and then excreted through our large intestine and out the other side. So if you need to swallow gum, it's fine. It's not going to cause you any long-term harm, and it's not going to sit inside your abdomen or your intestines growing a gum baby and lasting up to 7 years. It'll just get out after a couple days. Is blood really blue inside of the body and then becomes red once exposed to oxygen? No. We depict that in books, medical journals, all of this, even on TV, red and blue blood, just to have a more clear cut, know that this is oxygenated blood versus this is non-oxygenated blood, arterial blood versus venous blood. But in our bodies, the oxygen in our blood makes the blood bright red. And when it gets deoxygenated or goes into our venous system to go back to our heart and then pump to our lungs, it is more of a darker maroon kind of red. Bright red equals oxygenated blood that's in our arteries. Our venous system has deoxygenated blood, which has the maroonish color, not blue. But good question. Why do I urinate a little when I laugh or when I sneeze? Actually, this is pretty common. This is called incontinence. It's a medical word for when you accidentally have a little bit of urine come out. There are a lot of reasons for this to occur. There's something called stress incontinence, urge incontinence, overflow incontinence. There's a lot of different terms, but the most common reason, weak pelvic floor muscles. So the muscles around the area where we are able to hold in our urine, especially women who've given birth naturally, they stretch out all these muscles and can have the effects later on where they have have incontinence where they either cough or sneeze or laugh and it comes out a little bit. A way to combat that is actually something called Kegels, which is a type of strengthening exercises of the muscles of the pelvic floor in the body. Other things that can cause this are something called a neurogenic bladder, where the nerves of the body are not functioning properly to the bladder, so you can lose urine that way. Sometimes when a male has his prostate removed for whatever reason, or a woman has her uterus removed for whatever reason, those procedures can also lead to somebody having incontinence, to where they have to be careful when they cough, sneeze, or laugh, that sort of thing, and they can lose urine. If somebody has this where they have it happen all the time, the other thing you can do, unfortunately, is wear a liner, or make sure that you're going to the bathroom more frequently so your bladder's not so full and that you would have a little bit of urine come out. Where's the best place to get shot and still live? Where's the worst place? So please don't get shot at all. And I would say that the worst place to get shot and die would be your heart, and then maybe your head would be next, depending on how bad of a bullet, how close of a gun, different types of gun. There's multiple factors. So where would be the best place to get shot and still live is probably an extremity or your butt. So you want to miss major vessels, you want to miss bone, and you just want it to go into the soft tissue, so fat or muscle, and you want to probably go through and through so the bullet gets out of your body. Because I've said this before on many different platforms, that in the medical world, we do not remove bullets if they're stuck in your body. Unless it's sitting right there where you can easily pop it out, we typically do not go fishing for bullets to get them out if they haven't made themselves out of your body just by the initial force, because it causes more damage and we can injure more structures if we try to get it out. And these are typically benign. Please don't get shot. Be safe with guns. Hi, Dr. Wagner. Love you from Gameology. I'm really curious to know if there's an actual scientific way to make a penis bigger. No joke, that's the question. So there are there's two ways to surgically try to make a penis bigger. There's a ligament that you can cut to maybe give you about a ½ inch, as well as you can move your scrotum down the shaft of the penis to again make it appear bigger. But typically what you got is what you got. Now, creams, pills, lotions, these things do not enhance or lengthen your penis. Then other people have tried weights. So a urologist I know once said that if you actually try to use weights, you need to do it for about 6 to 10 hours a day for 6 months, and maybe you would get a ½ inch of extended length, but that's absurd. Also, a very simple way to give the appearance that your penis is larger is to lose weight. There's something called the mons pubis, which is the pubic area above the penis or your genitals, that if you lose weight will shrink down. If you gain weight, it'll get bigger. So it doesn't necessarily make your penis bigger, but it gives the perception that it's maybe larger than it actually is. So that is a quick, easy way and safe way to make your penis appear larger. Why does it feel so good to put a Q-tip in your ear even though it's bad for you? Everybody has cerumen. Cerumen is earwax, and they actually will slowly make their way out. What ends up happening is when we use Q-tips, we can potentially compact it down in and cause a buildup of this earwax and cause compression onto the eardrum, and then you have issues where you feel like you're underwater or ear pain. You can get an infection that way. The other reason why we say be very careful with the Q-tip is you can cause a tympanic membrane or eardrum rupture, where you can actually pop it open, and that causes a significant amount of pain, can cause permanent damage to the eardrum itself. What could happen if I hold my pee forever? You would probably die. Your bladder starts getting distended. You're still making urine. So your kidneys are trying to push urine down while the bladder is not allowing the urine to kind of get out because it's just holding on to it. So now you're gonna have a backup. You're gonna start retaining and holding on to the electrolytes that your body's trying to excrete. Your kidneys are gonna shut down. You're gonna have buildup of electrolytes, and the ones we really worry about end up being your potassium and your sodium, and they can cause cardiac arrhythmias. A lot of different things that can occur. Is it possible to accidentally fart your intestines out? Yes. If you push too hard, you can basically involute the rectum the wrong direction and it can pop out. And I've actually had to put many of these back in. If you're having issues where you squeeze really hard, you can pop blood vessels out, you're not doing things right. You need to see your doctor. You need to, evaluate what you're eating, how your intestines are moving, that sort of thing, to make sure that you're not going to hurt yourself. Why, when I sneeze, my right nipple has a transparent liquid coming out? I'm male. This should get checked out. It could be related to an infection. It could be related to a medication, or it could be related to testosterone hormonal changes, or it could be related to cancer. Anytime you're having abnormal discharge from your nipple, male, female, you need to be evaluated by your doctor, and it needs to be evaluated ASAP. Don't let it wait. Don't be embarrassed. I always wondered what happens if a doctor drops accidentally an organ to the floor. If this does happen, you basically need to pick that organ up, clean it off. You can't necessarily sterilize it, right? Because you might kill the organ. Anybody who's having an organ transplant who needs this organ is probably going to be on antibiotics to cover any type of bacteria that might occur. In general, when you have an organ that is so precious, you're going to do everything you can to preserve it. So if it's still viable and you can use it, and the risk and the benefits are weighed and the benefits greatly outweigh the risk, you're still going to use it. Do you guys know anybody who's had a transplant? Let me know in the comments. Is it possible for one to penetrate the uterus during intercourse? It is extremely, extremely, extremely rare. A lot of times the most common reason we see a uterine rupture or penetration would typically be from pregnancies and previous scars to the uterus itself, and they might tear open. But if this issue does occur, it's quite dangerous because you could have significant amount of bleeding, not just pain. And the body will try to contract down because the uterus is a muscle to get everything to stop bleeding, but it needs to be evaluated by an OBGYN and most likely have surgery to sew that tear or puncture back up. Is it true that picking your nose causes dementia? There was some research that was done saying that there's a possibility of potential nose picking causing dementia. The study basically was on mice, not humans. Do we actually have the data that shows this? No, not specifically, but it just raises the question because everybody picks their nose, but not everybody gets dementia. It could be a risk factor, but not a direct cause per se, because there are multiple other different reasons why somebody might actually get dementia, and there are multiple different types. If you're using a gown in the ER, is it okay if you're in your underwear? Absolutely. The reason why we want somebody in the gown is we typically need to do a head-to-toe exam, especially in the emergency department. Typically what ends up happening is you will be instructed to keep your underwear on, put the gown on, make sure the gown goes on the front, open in the back, and it just makes everything a little bit easier. The gowns that we have at the hospital I work have buttons too on the arms, so you can actually just unbutton just to expose that area. What would happen if you ate lead? Here in the United States, any old home that used to use lead paint has to disclose that because high amounts and chronic amounts of lead could lead to mental delay, cognitive issues, chronic fatigue. We potentially are exposed to very small amounts of lead, but chronic higher doses of lead in our bodies are not good for us.
Sir, we have to evacuate the entire neighborhood. I need you to leave your house immediately.
Just so everybody knows out there, literally lead could also lower sperm count. Should I be worried if I'm 17 and haven't stopped growing? No, not necessarily. It has to do with growth plates most of the time and different hormonal changes. But say you continue to grow in your 20s and mid-20s, then you always worry about some other abnormal hormonal things that are going on. One of the things that you think about is basically acromegaly, like Andre the Giant, who, continued to grow and was just a massive man, and he did have a shortened lifespan. Most people, most boys hit their peak height at around 16, but you can continue to grow and still gain inches anywhere between up to 18 and 20 years of age. Why should you never mix alcohols together? Example, vodka and beer. I don't mean results. I've already found them out. I mean causes of results. Liquor before beer, you're in the clear, and then beer before liquor, you've never been sicker. Typically it has to mixing. Some people are totally fine, other people are not, and it has to do with maybe the congeners, which are things within the products that might give you really bad hangovers. Clear versus colored liquors, that's part of the congeners. Also has to do with the hydration status. If you're having liquor, it could be just straight, or it could be mixed with mixers that are high in sugars, which could also lead to hangovers. And then instead of drinking water, you're following it up with beer. But at the end of the day, you need to just be aware, hey, let me just stick with one type of alcohol tonight. That would probably be your best bet. For all of you out there who can drink, let me know in the comments what your go-to hangover remedy is. I've been doing a lot of research and developing a product that potentially will help and make the next day after drinking so much better. I just wanted to drop a teaser on that because there's more to come later. Keep an eye out. One testicle is lower than the other. Why is that? And should I be worried? Don't be worried. that is 100% normal. Some it's the left, some it's the right. Doesn't really make that big of a difference, but typically the reason why is usually one testicle is a little bit larger than the other, which means that it's typically a little bit heavier, so it'll just hang a little bit lower. Plus, think about it. If they're sitting right next to each other, they're banging against each other, versus if they're just a little bit off, they fit a little bit more snug in there. Don't forget, make sure that you're doing self-exams, making sure that you're feeling for any abnormalities. Your testicles should be nice and smooth with the epididymis on the side, and making sure that you don't have any lumps, weird growths, any discomfort. Why do I have to poop when I get nervous? Oh, that's a good question. Pooping when you get nervous, anxiety, has to do with like your nervous system, your parasympathetic versus your sympathetic nervous system, or your autonomic nervous system. So your sympathetic nervous system, you get anxious, you get release of epinephrine, different serotonins, and then basically dumps your gut. Basically, it has to do with your autonomic nervous system, where it's affecting the brain-gut connection. Has to do with secretion of different enzymes, which increases gastric juices. A lot of times people who have bad anxiety also suffer from irritable bowel syndrome. They are connected. That's why you can potentially poop when you get very nervous or have anxiety. Hey, Dr. Wagner, I had a question. Does wearing certain underwear affect the amount of semen you produce? Like, say, if you wear briefs or boxer briefs or other tight underwear. Good questions, but there are studies that actually are back and forth about this. Testicles are outside the body in your scrotum. They're outside because they actually do need to be at a lower temperature, 4 to 6 degrees below what our normal body temperature is. The idea behind the tight pants and the tight underwear is that you're bringing your testicles closer to your body, increasing the temperature. It has nothing to do with the production of semen, because semen is actually what the sperm swim in. But the sperm production is still the same, but there could be mutations or not highly functioning sperm when you raise temperatures. There are also studies that show that degree of change and the temporary effects of your clothing being tight doesn't necessarily actually affect it more long term. So good question. So wear whatever you'd like to wear, whatever's comfortable. What can happen if we eat dog food that looks and tastes like human food? Good question. Eating dog food in probably a short period of time or in small doses won't hurt you, but it's made for a dog. There are different vitamins and nutrients that are placed in it, like supplements that are advantageous to a dog versus not so good for humans. We shouldn't be eating as much as what's in there. There's a lot of byproducts, there's a lot of soy products, there's a lot of stuff that you normally wouldn't eat. The dog food should be as close to what they would naturally have, but hitting their nutrients. So there are different things that go on in a dog's body versus our body relating to the nutrients that it needs and produces on its own. So to come back about the dog food, no, you shouldn't be eating dog food on the regular. If you accidentally eat it, you will be okay. Is there a medical way to make feet stop smelling so much? Yes, there is, and there's a commonality of this. So the word for smelly feet is actually bromodosis. There's actually a medical term. And the most common reason for smelly feet is sweaty feet. We have so many millions of sweat glands throughout our body, and the feet has 250,000 about, so to speak. So what happens is when you sweat, can have different types of bacteria that grow in these areas, thus producing bad smells. Make sure you wear socks that are like cotton or wool, natural fibers, so that they don't hold on to the sweat. If you do get sweaty, change the socks out. Make sure you're cleaning your feet, make sure you're showering, and just good hygiene. Keep your feet dry, which will then reduce them from smelling. Question for this series: why do I sneeze like a maniac when I look in the general direction of the sun and when it shines on my face? Otherwise, I'm not, but when that happens, I sometimes sneeze more than 20 times a minute. This is actually a true reflex. It's called the photic sneeze reflex, but it's actually like inherited and congenital. 18 to 35% of the population actually have this, and people who get sunshine or different type of lights actually are more prone to sneezing. It's in the same category if somebody basically eats something and then they sneeze after. So it's not anything bad, and you can just blame it on your ancestors for giving you this gift of sneezing. Does masturbation cause acne? No. Masturbation has nothing to do with acne. When somebody has an inkling to masturbate more, it's typically as they're discovering themselves and having hormonal changes, which then increases the likelihood that you're having acne at the same time. Does the act of masturbation and releasing more often increase your risk of having acne? No, it doesn't. next. Why is my pee yellow? Good question. So there's actually like a byproduct in the urine that makes it yellow. It's called urochrome, and it has to do with like the breakdown of cells in the body. It's excreted through the urine. The lightness or the darkness of the urine of that color yellow has to do with how hydrated or not you are. So if you're very hydrated, it's going to be a very pale yellow to clear, versus if you're very dehydrated, you can be super dark. But there are also many different colors of urine. Yellow equals urochrome, which doesn't equal anything bad. I read a life hack article, I can't remember where, a while back, which suggested that a stuffed up nose could be relieved by firmly pressing the tongue to the front of the roof of the mouth for about 30 seconds. I was skeptical, but I have tried it and it seems to work. Is there any anatomical reason for this to work, or is it simply a placebo effect? It's not a placebo effect. There are different nerves as well as vascular supply to the roof of the mouth. Say you have brain freeze, right? So you actually shove your thumb to the roof of your mouth or to the palate. What you're doing is actually warming it back up. So you're causing the blood vessels to redilate, which is part of the mechanism of why you're actually getting this brain freeze. Pushing your tongue to the roof of the mouth, it has to do with basically a nerve impulse to that area. But I've also seen that you actually put it in conjunction with like pushing on your forehead, and it's all related to like pressure and nerves. If you have like a stuffed face or a nasal congestion, we actually have multiple pockets in our faces where this could occur. You have your maxillary sinuses that sit next to your nose or your nasal cavity. Then you actually have your frontal sinuses, you have your ethmoid sinuses. It can be filled with fluid when you get really sick and cause a lot of pressure because it's bone that's not expanding. So it needs to get out of there so it all drains out. If by pushing your tongue against the roof of your mouth that you feel better, hey, you found the hack and it works, use it. Does cock size matter? Not really. So let's dissect this and break this down a little bit. Size matters subjectively to the individuals, right? If you're on the extreme of a bell curve, right? Too big or too small, maybe there's issues, right? Too big can cause pain to your partner, can cause tears and bleeding and injuries and not satisfaction, uncomfortability. Too small, you might run the risk of not being able to pleasure certain spots in the body. But most people are an average size length, average size girth. And why would a person taking in the penis basically want something huge that can hurt them? They don't want that. The person wants to be pleasured, right? At the end of the day, size only matters to be able to get into the right position to give pleasure to your partner. Is it true if you don't go to the bathroom to take a leak, your kidneys will pop? No, your kidneys won't pop. I've seen kidneys rupture due to trauma, but not from not going to the bathroom. Your bladder starts filling up. You start getting horrible pain down in your pelvic area. You get hydronephrosis, which is just a swelling of these kidneys and the ureters. The pain in itself will cause you to get help. So it won't pop, but you'll be in extreme pain if you don't urinate. Next question, is it possible to puke from stress? Yes, we see this very often. People get nauseous and they vomit due to stress, anxiety, being overwhelmed. If you find yourself to be one of these individuals, please talk to your doctor and make sure that you have an antiemetic medication at the house. Have you guys ever thrown up from stress? Let me know in the comments. Can the tailbone be removed like wisdom teeth, or is the tailbone necessary for the human skeletal to stay intact? Yes, you could remove the tailbone, but it's quite rare because people can have chronic pain and dysfunction of this area, but it theoretically could be removed. Whereas wisdom teeth, there's a lot of people out there without the wisdom teeth. I have my wisdom teeth removed. Doesn't mean I don't have wisdom. How many of you out there are sans your wisdom teeth? Next question. I have seen some people's eyes moving a little bit side to side without them noticing. Is it a trait that someone is born with, or is there something else like a disease going on? I also wonder if you can see normally, or does it affect what they look at move like their eyes do? Yes, so that's called nystagmus. Nystagmus is when the eyeballs kind of wiggle. Sometimes, yes, there is a cranial nerve dysfunction that can cause this, or if you have bad vertigo, this could occur. Basically, shaking of the eye will actually induce significant amount of dizziness and cause nausea and vomiting. Some people might actually not notice it, but it's quite fatigable. Everybody has a little bit of it, but after one or two kind of ticks of it, it typically is fatigued and doesn't happen anymore. My poop literally became 100% liquid and my stomach just wants to push it out from time to time. What is wrong with me? 100% liquid poop. Typically when somebody says it's liquid, to me that is diarrhea. But liquidy stool basically means that the intestines are not absorbing the water within the stool itself and your body is trying to get it out of you. And usually it is infectious. If it's something that has become more consistent, definitely get checked out by a gastroenterologist. Next question. Is it true syphilis can cause one to go mad if not treated, and why? Yes. Syphilis is a STI, a sexually transmitted infection that causes an ulcer, a painless ulcer. There is multiple different stages of syphilis. One of them is called neurosyphilis. And so yes, if it goes untreated, it affects your brain and the nervous system. It can cause mental disorder. If you're concerned about it, get tested. There is blood tests that you can do, but it's a bacteria that's super easy. It's treated with 1 or 2 shots. Next question. What does vaping do to the body? Well, vaping in itself can cause harm to the lungs. Just like cigarettes, when they first came out, they thought they were healthy for individuals.
Tens of thousands of doctors in all branches of medicine, in all parts of the country, were asked that question.
Until many, many years later, and they found that they were very bad for us. Same with vaping. Vaping right now, they're saying is better than cigarettes, so it's a better alternative. But again, there's no long-term studies of this stuff, and you don't know exactly what chemicals are in the liquid that you're vaping. Just something to be aware of. Where is earwax made? So earwax is also called cerumen, and basically it's a combination of the oils that the skin of our ear canal make mixed with the dead skin cells of the ear canal, as well as dust and debris that gets in there, as well as the point of it is actually to protect the eardrum from the dust and debris that we encounter in the environment. Where do crab lice come or originate from, and how are they dangerous? Crab lice is basically a parasite that feeds on human blood. It's typically found in the pubic region. Okay, it's different than exact lice that we see on somebody's head or head lice. They spread through close contact with somebody who has this, or you're sharing garments, so please be aware of that. While they're not dangerous, they're more of a nuisance and irritating and very itchy. All right, next one. I have scoliosis. I've heard it's possible that I could pass it on to future children. Is that true? Yes, there is a component of genetics when it comes to scoliosis. So it is possible to pass it along to your offspring, but there are also other factors that also go into this. Up to 80% is actually unknown what actually causes it, but arthritis, osteoporosis, degeneration of the discs, etc. And obviously running in your family. Next one. What is electroconvulsive therapy, aka ECT? ECT is basically a medical therapy for psychiatric conditions like severe depression, bipolar, schizophrenia. It kind of can be used almost for any psychiatric therapy, and basically using controlled energy to shock the brain to almost try to reset it. It is relatively safe. Pretty much the major side effect has to do with amnesia, but it's usually just to the event. Next question. I have an IUD and a lot of people I know have them or have had them. I was wondering if there is a way to tell whether the IUD is in place or not. Like, how do I know if it is at risk of falling out or if it is at risk of puncturing the uterus? Thanks so much again. Have a great day. So what is an IUD? It's an intrauterine device, and basically there's a couple different kinds. Sometimes there's just ones that like is copper and it just causes irritation to the uterus, preventing, so it's basically birth control. Also, there's a string attached to these because that's how you get them out. And if the string length has changed, the position might have changed as well. Just something for you to be aware of. If the brain doesn't have any pain sensory nerves, why in the world do we get headaches then? That is a great question. So the brain tissue itself is insensate. And there are other components that have nerves around blood vessels. The meninges has nerves. And there are different types of headaches. There's migraine headaches, there's cluster headaches, and there are tension headaches. Those are the big ones that are out there. And again, they have multiple different mechanisms. Okay, next question. Hypothetically speaking, could you shock someone with an electric eel if their heart stopped in the wild? Well, in a biphasic machine, we're using 200 joules, and in a monophasic machine, we're actually using 360 joules. So if an electric eel can give an equivalent amount of energy, then sure, it's good in theory. All right, next question. Mike Tyson is fighting biting Jake Paulson. I know he bit someone's ear in the past. Have you ever seen a bitten off ear? It is not very common, but people do heinous and mean things to individuals. And yes, I've seen an ear bitten off, pieces of it coming off. Luckily, if you have the piece of ear and it's within a good timely manner, there is a chance that you can actually put it back. Please don't bite each other's ears. Next question. What do you do if your dissolvable sutures don't dissolve? That is a great question. You can cut them out. So do I advise you as the individual to cut them out? No. If they're still in after the period of time that the doctor recommended a suture to be in, maybe get it checked out, and if they are still there, they can remove them. Next question. Why do we have different type of blood types? Seriously, it's weird.
Nobody makes me bleed my own blood.
Well, the different type of blood types are related to genetic variations and variability. We are very unique individuals, and thus, as we have evolved, there have been different types of blood types out there. So you have A, you have B, you have AB, and you have O. And then you also have the RH factor, which is the positive or the negative. So you have those combos, and then you actually have the very, very rare individual out there who is RH null. They don't have a negative or a positive. So, yep, there's a lot of different genetic variability when it comes to our blood type. Last question. Is picking your nose dangerous? Who doesn't like to pick their nose?
Hold it.
But make sure you pick your nose with a Kleenex or a tissue. Please do not use your finger that's bare. It increases the risk of infection, cuts in your nose. And they were trying to show a study recently that sometimes the infection can potentially go to your brain. So just be aware of this and don't pick your nose and don't flick it on your friends. You can pick your friends, you can pick your nose, but you can't pick your friend's nose. Is there a possible way to make yourself smarter without school/high school or university? The question ends up being, are we talking about making ourselves smarter like increasing brain power and the amount of neurons that are firing anatomy-wise, or gathering information more on a topic we're interested in? Your probably best bet is one, the internet, and the other is surrounding yourselves with people who are the gurus and the experts in the field that you want to learn about, because then you will absorb, you'll learn, and get further educated. And there are also people out there that specialize in teaching individuals how to almost like absorb material more, have better memories, and to access those memories. So there are different possibilities out there to where you can actually learn better, learn faster, and potentially make yourself smarter. Is it normal to automatically pee while taking a dump? Yes, actually. The answer is yes. You have two sphincters for your butt, and you pretty much have two sphincters for your urethra. It takes a lot more focus and musculature to relax your anal sphincters to let poop out. So then you're using the different pelvic floor muscles, and when you actually relax them, you also relax your urethral sphincters and allow urine to flow too. It is totally normal to take a dump and pee at the same time. Can I die from licking salt off an entire pack of saltines? If you can accomplish taking all the saltines out of, I'm assuming the box, the whole pack, if you just lick all of them, it's just not smart. Too much salt will lead to bloating, hypertension, a lot of things that you just don't want to happen. In the United States, most of our diets are way too saturated with salt. We put salts on everything. Salt is good to a point. We have sodium in our bodies, so we have to have sodium to have a normal functioning. Be really careful, be cognizant of licking saltines or not. I don't think you'll die from licking the saltines, but please don't eat the whole box of saltines at once. I'm not getting erections every day. How can I improve my erections so be my hardest? So there are multiple medical problems that actually can cause issues relating to erections. What can you do about it? So the first thing that you can actually do about it is address the underlying cause. So if you don't have any of those causes, then you can potentially see a doctor about medication. Everybody's heard of Viagra, the blue pill. You could also use penis pumps to engorge the penis to get it harder, that sort of thing. Because it's a real thing, and I think a lot of guys get really embarrassed relating to the fact that they're worried about getting it up or not getting it up. And don't forget, remember, there's actually something called whiskey. If you go and you drink too much alcohol, you may not be able to get a hard erection because you're inhibiting yourself with the alcohol. So just be aware of that as well, that medications, drugs can also influence how your member operates. My question is, can we regain our eyesight naturally? I hope we get there one day, but in general, when somebody's eyesight is going, it all depends on the reason why. Did you have an acute blood vessel get blocked and you have a retinal artery occlusion? Could you potentially get that back? No, because you caused ischemia to the retina and now you have dead cells to that area of the eye. Say you have macular degeneration because of diabetes. If you have your diabetes under control, then you potentially won't get macular degeneration. There's a huge spectrum of where this question goes and can we fix our eyesight per se. When it comes to as we get a little bit older, you get something called presbyopia, basically where we can't accommodate as things kind of shift in depth of what we're seeing. That typically cannot be fixed. We're not there yet. In general, right now, we don't have the natural way to improve eyesight. Question number 7. I have a friend that can dislocate his arm on command, and he said it doesn't hurt. Is that normal? Like double jointed, or should he see a doctor? Dislocating a shoulder is rough. I, as an ER doctor, have to put them back in. Typically, an orthopedic surgeon is only called if you can't put it back in or they need surgery. But if you can dislocate it and relocate it all the time, what does that mean? That basically means you dislocated enough that the ligaments, the tendons, and all the muscles surrounding the area are stretched out to where it's not holding the humeral head in the glenoid fossa, which is part of the scapula in the shoulder. And then you can actually have injuries to the glenoid rim and the labrum, something called a Bankart lesion, or basically a Bankart injury, or a Hill-Sachs injury on the head of the humerus. These also interact and play in the sense of how easy something goes in and out. If somebody is having a shoulder go in and out, you could try physical therapy to get the muscles and the tendons and ligaments to kind of try to tighten up all together. What's the harm going in and out? One, it's an unstable joint, which isn't good. And then the other component is you have what's called your brachial plexus, which is basically nerve bundles that come through your armpit from your neck out into the arm to innervate the whole arm. So if you keep having injuries, you can cause neuropraxia, injury to those nerves, which then can potentially cause permanent damage. Is it normal to generate a lot of heat when sleeping? I'm a small person, but even with a light blanket and sleeping au natural, I heat up the bed enough to wake my boyfriend sometimes. This question actually hits home personal experience. I also sleep next to a radiant heater that is a human being, my wife. So people sleep all different temperatures. When we actually do sleep, our body cools down a little bit, a degree or two, and that is also why we like to sleep in a cooler area. So if somebody's sleeping warm, it's not necessarily anything bad. There's a lot of different factors that play into it, but there are also ways to cool yourself down. There are cooling blankets, there are cooling mattress pads, there are fans, there's ACs. There's a lot of different ways to cool your body down. There have been studies to show that if you actually sleep cold or colder, that you actually get a more restful, deeper night of sleep. So those individuals that do sleep hot aren't getting as probably a restful night of sleep as somebody who sleeps cold. Here's one for the uterus havers. Why is it that sometimes I have a period where I can barely feel a thing, but other times the pain is so bad, I cry and I'm totally debilitated? I always thought that menstrual pain is fairly consistent cycle to cycle. So actually that is a great question. Right, the menstrual cycle should be consistent in the sense of timing. Also depends on a lot of factors relating to the menstruation. If you have a light period where you're not bleeding as much, probably not going to have as much pain. If you're gonna have heavy bleeding, then you're potentially gonna have more pain. It has to do with the uterus itself is a muscle. And so the muscle is contracting, trying to kind of shed the lining of the uterus. It sheds every month. That's part of the menstrual cycle. It has to do with also trying to stop bleeding versus getting any of the tissue lining out per se. Things that can get in the way or cause horrible pain could be fibroids that are in the uterus, polyps that are in the uterus, even bad cysts on the ovaries can cause pain. And one that a lot of people don't think of is actually being dehydrated. It can cause contractions and pain that are stronger than if you were hydrated. Make sure during your menstrual period and when you're having cramps that you are well hydrated. It actually isn't that abnormal. Unless you're seeing a huge swing and a huge change, you should definitely get checked out by your OBGYN. Hello, Dr. Wagner. So I have a question for you that is a little sensitive to me. This is why I'm emailing you as opposed to social media or the comments on YouTube. So as I've gotten older, I've noticed that my penis has quite the downward curve when erect and wanted to know if it's normal or if I should go see a urologist for this. Well, that is actually a really, really good question. We're not all made perfectly, and actually penises, they go all different directions. It can curve left, it can curve right. It can go pretty much any direction. So that is normal. What's abnormal is when maybe if it's angulated more than 30 degrees or that it continues to increase in that direction. So you've always had it at this certain angle and now you're seeing it get worse. If it's just a mild curve, that is totally normal. So if you're having any concern about your penis, please see a urologist. Why do some people have outie belly buttons and some have innies? I'm an innie. Where my team innie at? Okay, so belly buttons is also called your navel, right? It's where our umbilical cord attaches to our body when we're inside the uterus, inside the womb, and it's literally how we get our oxygen, our nutrients, everything from our mom to us while we're in the womb. But then the question ends up being is, why do some people have an outie and why do some people have an innie? Well, it just has to do with how the stump of the umbilical cord after it's cut off heals. Okay, so baby comes out, you need to cut the umbilical cord, so you clamp and then you just cut so you don't have any significant bleeding and you leave that clamp on, and basically it's how the individual heals. If you get a brain freeze from eating ice cream too quickly, could you reverse it by quickly eating something hot?
I got that brain freeze.
When you get brain freeze, it has to do with nerves and blood vessels relating to the roof of the mouth. So could you then put something hot in your mouth? Yeah, it could potentially reverse it or stabilize it. But what ends up happening, I just don't want individuals to like burn their mouth. So probably a little bit safer way to do this is with a clean thumb. You just push on the roof of your mouth into that area. So you have the warmth of your thumb or your finger and then the compression of the nerve in that area, and it'll decrease that firing. Next question, what is an appendix and does it prevent diarrhea? So great question. So what is an appendix? An appendix is what we kind of call a vestigial organ or piece of our intestine. We always thought it was not important, just get rid of it and it's fine. But now we found that there is some benefit of the appendix when it comes to gut health. But can you live without it? Yes. But if you do get an infection of the appendix, we get rid of it. And then the other part of this question is, does it prevent diarrhea? No, it does not. But if the appendix pops, then you got diarrhea basically into your abdominal cavity, which then can lead to sepsis and death. So hopefully you don't have that happen. Every time I eat spicy food, my face turns red and I start sweating. Is this an allergic reaction or just my body handling the heat? Also, considering the skin is an external organ, why does something I eat affect it so visibly? Your face turns red and you sweat due to eating spicy food is actually a normal response. It is not the same as an allergic reaction. That is a different response that has to do with your immune system and your antibodies responding, and it's a lot more complex. So yes, when you have a reaction, the skin is part of your body. It's got nerve endings related with blood vessels. And so the vasodilation, contraction, as well as your sweat glands are all interactive within your system. So there's a lot of your response relating to your skin. Do the hands of penis actually get longer than other people's hands? If so, how does it work?
Hold it. This is getting confusing.
So no, the hands of a penis do not get longer, your fingers do not grow, but they become more skilled and dexteric and flexible, meaning because of all the actions that the hands do, they can spread out further, they have much more control of the muscles and how they move and the mobility of the joints themselves. So it gives the perception that they might be moving further or longer, but it's just their ability to control them a lot better than somebody who doesn't have that dexterity. I do play the piano. How many people out there can play the piano, and what's your favorite song to play on the piano? Let me know in the comments. Can hemorrhoids lead to cancer in your rectum? So first off, what is a hemorrhoid? Hemorrhoid, we have internal hemorrhoids versus external hemorrhoids. So internal hemorrhoids bleed like stink. External hemorrhoids hurt like stink. Okay, so you can have both. Then the question is, are hemorrhoids cancerous? No, they are not cancerous. But a hemorrhoid and rectal cancer can have similar symptoms, such as pain if they're external, bleeding and irritation down there, as well as some swelling. So just get checked out if you're having something abnormal. I hate sneezing, to be honest. Is holding your sneezes potentially dangerous? Well, holding your sneezes is not probably the best thing. You're trying to be nice and not spit on everybody, but you increase the risk of perforating your ears, popping some blood vessels in your eyes and your face, a bunch of different things that you don't want. Literally, I've seen people who stifle the sneeze after like facial injury, and then they get subcutaneous air in their tissue and their face swells up, so not good. So if you're gonna sneeze like this, or and then make sure that you wash your hands thereafter. If it was a true emergency type situation and you're not near a hospital and you crack your head open, could you use a household stapler instead of medical staples? Could you use it? No, it wouldn't actually work the same way, okay? So what ends up happening is the device that the staple gun at my work uses at the hospital, it actually comes around the wound and makes a rectangle basically, versus if you were just to use a staple, it actually just shoots right in. So no, please do not use a household staple to try to close up wounds. What I have suggested in the past, if you do have a scalp laceration from a head injury and you don't have access to this stuff, you could use your own hair around the wound and tie it if it's long enough, but do your best to get help. Is it true that if you eat too much licorice, it can be bad for your health? My grandpa told me that, and I don't know if I believe him.
If there's anything I'm a sucker for, it's licorice.
So, consuming too much licorice, yes, could be harmful. It contains glycyrrhizin, which can cause your potassium to go down. So if your potassium goes down too much, then you can have all different processes in your body go awry, but the biggest thing you worry about is cardiac arrhythmias. So please don't eat too much licorice. Can wearing tight underwear affect a man's fertility by overheating the testicles?
Is it bad?
Yes. Wearing the classic tighty-whities could cause, if they're too tight, your testicles to heat up and might not be at the optimal temperature for sperm chilling out and being made kind of thing. So sometimes wearing tighty-whities is actually beneficial if somebody has, say, an infection where you have epididymitis or orchitis. These are infections of your testicle or your epididymis. Then having support is quite helpful, but I would advise not wearing tighty-whities all the time. Next question. Are bodies really negative pressure? How does that work? I'm asking because I had a friend get something stuck in their body somewhere and they said it was because of negative pressure. So yes, we are negative pressure.
Sucky. Oh, wonderful. Yes. That is marvelous how that...
Think about it. When you breathe, you don't really work hard to like suck the air in. It's like, it just flows in. Same thing with your butt and your rectum. It is negative pressure down there. So that is why you need to push when you're having a bowel movement to get it out. We see it often enough where people accidentally lose foreign bodies up their rectum because they go to a certain distance and then there's a negative pressure pull-up and they kind of just get sucked up. Please be careful. What the heck? I have sudden round red spots on my arm and near my groin area. What should I do? Okay, well, it's pretty hard to diagnose what round red spots are. Could it be a hive or an allergic reaction spot? Could it be psoriasis? Could it be candidiasis, which is a yeast or fungal infection? Or could it be ringworm, which is another type of fungus out there? So a couple different things. We'd need to be able to look at it, take photos of these things, and show your primary care doctors. If I accidentally eat a lot of seeds, like from an apple or watermelon, could they start growing inside my stomach because of the warmth and moisture? Or could anything grow inside of a human like this? So no, seeds do not grow inside of our stomach. It's the acidic environment, so it does not. But you gotta be careful. Please don't eat too many seeds because there's issues relating to cyanide, but you have to eat a lot of seeds. But again, a few seeds are typically okay. And could anything else grow inside your body? I mean, parasites, right? There's different types of worms that could get in there. So I've had individuals accidentally or on purpose stick potatoes inside their bodies in places they shouldn't have been, and then the potato starts to sprout and grow inside. Please don't do that. It's almost the 4th of July, and I once burnt my hand on a firework. Have you ever seen a missing hand or other bad firework injury? Yes, almost every single year. We see people who have blast injuries to their hands, their face, their heads because of the misuse and the misguidance of using fireworks. So if you do use a firework, make sure that you get expert help with this. Please be careful. So 4th of July, fireworks, it's gonna be a lot of noise and fun. Some people wanna sleep, but because of the loud noises, you may need a little extra support. That is why I came up with my supplement called Do Not Disturb. Do Not Disturb has a balance of magnesium supplement in it to help calm the body, as well as multiple other good body relaxation, sleep promoting ingredients. Definitely check it out. Do Not Disturb. Is it normal to leak urine when I laugh, sneeze, or exercise? Normal? No, not normal. Is it horribly abnormal? Probably not. But if you're a male, you're going to a urologist. If you're a female, typically you're going to an OBGYN. And basically you need to see, is it your pelvic floor muscles that are causing the issue? Is it the bladder? A lot of different things that can happen, but the most common reason for somebody to have leaky urine is actually after you've had a baby and you've delivered, the muscles of the pelvic floor have been stretched out, and so it doesn't hold the urine in as well. So great question. Hopefully you don't have that problem or any of these other problems that are out here, but I appreciate you guys asking me these questions. Just a question. What I was thinking is popping / cracking our bones healthy? I'm cracking my neck, my back, and elbow so many times, and it just feels so good. Cracking joints is typically okay. There was actually a crazy cool study, really small, by a doctor that spent like his whole lifetime cracking one hand and then not cracking the other, and then did x-rays to see if there was any damage, and there was nothing that showed of that. Sometimes we ask, like, what is the popping noise? Sometimes in the joints, like in the hands and your knuckles, it could be a little bit of like a air pocket, like a bubble of air within the joint, and it pops. That's why it doesn't re-pop. Typically it doesn't happen in all over your joints, in your neck and your elbows and your back, that sort of stuff. Those are okay. So sometimes we can be a little misaligned and it's out and it feels good to get popped back in. There are some dangers. If you're too aggressive, you can cause potential dislocations of the joint and potentially ligamentous or tendon injuries. So just be careful. Hey doctor, I'm a big fan of your YouTube channel. I just want to know that if a 14-year-old does deadlifts, can it stunt my growth if I do it in the correct position and technique? Also, keep up the amazing work. Well, thanks. But this is pretty much a myth. With adolescents, our growth plates are open. So the concern is, could you injure or inhibit your growth plates in any which way? You don't. As long as you're using proper technique, not going in any abnormal movements, twisting motions, that sort of stuff. Continue to lift in proper form. And if you have a passion for weight training and weightlifting and powerlifting, get after it. I got a question. I know that caffeine is supposed to make you stay awake and somewhat productive. When I drink coffee, I feel sleepy or tired, and so does my father. Is there a reason for this? Yes, there could be a reason for this. So it all depends. One, if you're drinking coffee with sugar, you could be having a sugar crash after, so that's pretty simple. What ends up happening is you're blocking the receptors of adenosine, so you're more alert, but what happens is your body is still making that adenosine. So when the caffeine wears off and the receptors get open again, boom, you get a really big rush of adenosine, which then makes you feel tired. Also, caffeine and coffee basically is like a diuretic. Diuretic meaning it makes you excrete water out of your body, which in turn will cause dehydration, and then dehydration can cause tiredness. Hey doc, I have a question. Why is my left ball short? My right ball is a bit long. LOL. Okay, all right, good question. One testicle potentially will hang lower than the other. Sometimes it's the right for people, sometimes it's the left. And they have their own nerve, blood supply, spermatocords, all these different things. You can actually even have different size testicles. It is normal for it to be asymmetric in how they hang in your scrotum, and it typically changes, right? So when the temperature changes, your scrotum sucks the balls kind of tight inside because it has to do with temperature regulation, and that the sperm basically want to live in an environment and be made in an environment that's a little bit cooler than the 98.6 degrees that our body is. Make sure that if you have any pain, get it checked out. If you feel any lumps, get it checked out. Weird question for you. Why do I sweat so much all the time? So there's something called hyperhidrosis, basically meaning you're sweating excessively in a situation where you typically wouldn't be sweating. About 5% of the population has this disorder, but you actually can go see your doctor, and there are different treatments that can be done. This includes like topical medications, oral medications, low electrical type treatments, as well as different surgeries. And then again, changing things in your environment and just making sure that there's no secondary cause for these things. Make sure that you see your doctor, get this diagnosis first before you try to self-diagnose too much, just to make sure that you're not having anything more serious going on. My dad's girlfriend says that she never farts, but she has the most impressive burping skills that I've ever heard. Does she actually not fart? Typically, people who say they don't fart are farting when they go to the bathroom. When you go poop, you have gas buildup as well. You relax your sphincter muscles, everything kind of opens up and whatever's in there comes out. You can't avoid farting. You can't just poop without farting. Sometimes you can have a buildup of gas and you'll let them out, so you just have a little bit less gas. Make sure that you're passing gas, burping, farting, let it out. Better out than in. Hey doc, I swallowed a bunch of pebbles and screws as a child. Will they hurt me in the future? Well, typically not, okay? A pebble, a small screw. The screws you got to be careful with because they're sharp, so you worry if they're going to puncture something. Non-sharp and smaller than a certain length, typically we won't go in to go get them. You'll just pass it through your digestive tract and they'll come out of your body. Now, if they're larger than a certain length as well as concern for perforation and they're still in your stomach, a gastroenterologist will actually emergently go down with an EGD or upper endoscopy and go in and retrieve it. Hey doc, effective remedies for weight gain. The first thing you think of wanting to put on weight is eating more, but you also want to eat more of the good stuff. So you want to eat things that are nutrient rich. What I mean by that is you don't want to eat massive amounts of salads all day long because the caloric content is really low. Remember, even though this might be an old statement, normal energy expenditure is 2,000 calories. So if I eat 2,000 calories, but I'm burning 2,000 calories a day, I'm net neutral. But if you have less calories, over a period of time, you're potentially going to start losing weight. And then the flip side, if you're having more calories that you're ingesting in versus what you're burning, you're potentially going to add potential fat or even muscle. That's a basic, simple way to think about it, but it is obviously more complex. Is it true you can actually grow horns out of your head from poor posture or looking down at your phone too much? Actually, a really good question, because first thing I think about somebody saying growing horns out of their head is like horns coming out of your head. No, you wouldn't grow those. Sometimes people do get these abnormal skin growths and they're actually called cutaneous horns, and it's actually cornified tissue, but that is not from looking at your phone. It wouldn't be a horn, but it could be a bone spur. If there is tension on where your muscles and tendons attach to a bone, it can actually start pulling on the bone very slowly over time, and the bone can actually grow a little bit. So question number 2, is it normal to fart without stopping for like 30 seconds? So yes, you can fart for a long period of time due to the fact that you have excess gas in your body. If somebody has that much gas in them, it's actually going to cause abdominal distension and feel really uncomfortable. But you know what's very interesting? The Guinness Book of World Records has a fart that goes 2 minutes and 42 seconds in one continuous fart. What? I need to hear that. I wonder if it actually really smells, or is it SBD? Is it silent but deadly? Or is this one just super loud and doesn't smell at all? Question number 3. Is it possible to strangle someone with their own intestines? Yeah, not really. You see this a lot in video games where all of a sudden your intestines come out and they're just like these tubular structures with no attachments. That's not how it is in real life. They're all attached. The small intestines are attached by what's called mesentery. It's connective tissue that keeps it kind of in a ball. You know, unless you're able to rip that, very much unlikely in the intense scenes that we would probably see in movies. Okay, here we go. Question number 4. Why, when I have an erection, does my pee come out in 2 streams? Oh, good question. So usually it's not anything crazy scary. Usually there's some ejaculate that might be stuck still in there. Your prostate could be inflamed and has something called prostatitis, but also just in general, you have an erection, you have swollen tissue, so your urethra, which is a tube where the urine comes out of, could be compressed a little bit, so it actually might squirt kind of through the sides. As long as you're having a normal stream when you urinate without an erection, everything is most likely fine. But just wait a second, let the erection go down and urinate as normal.
Just go, man!
Question number 5. Oddly specific. I cuddle with my girlfriend every night, and a lot of the time when I wake up, my skin has these weird red marks that look like her dreadlocks. What could this be? Should I be concerned? Great question. Obviously, we can get inflammation of our skin for multiple different reasons. I need to see specifically what it looks like. But the other component of this is because, you're laying there, you're falling asleep, there's a compressive force, which then when it's relieved will cause redness to the area and in the shape of whatever you laid down on. So it could be as simple as that as well. Question number 6, will I have to be gluten-free my whole life if I was born with it? If you just have gluten intolerance, there potentially are some over-the-counter medications that you can use to help with that sensitivity and help with digestion, help with the bloating and the uncomfortability. If you actually have celiac disease, then because it's an immune reaction, trying to take over-the-counter supplements will probably not help you. And you do have to be concerned if you continue to expose yourself, then actually you can cause long-term damage to your intestines. So avoid the gluten, but get a formal diagnosis to confirm. Okay, question number 7. I feel like I have 2 balls in one ball sack, like there's another one connected to it. Is it like normal? Maybe a spermatocele? It doesn't hurt or itch or cause problems. Very interesting. This could be multiple different things. Most of the time, it's probably something like a small pocket of fluid, but you need to get checked out because you really want to make sure that this isn't cancer. If you have testicles, you need to be doing self-exams and making sure you don't feel any lumps or nodules or abnormal growths on them. If you do, you need to get an ultrasound of your scrotum and you need to see a urologist. Question number 8. So I'm trying to eat more healthy and work out more, but now I feel lightheaded after eating less than I normally do. Should I be worried? Well, yeah, a little bit. You got to be careful, right? One, you have to think about hydration status, so make sure you're getting enough fluids. Then the other component is your energy expenditure is now higher, but you're potentially taking in less calories. Is it a blood sugar issue? Are you not eating enough and your blood sugar is dropping? You do need calories in any exercise routines that you're doing, and so please be careful. Definitely discuss what your diet habits are with somebody who is knowledgeable in this area and can help you and prevent these symptoms from happening. Question number 9. Why is it a popular myth that popping or cracking your knuckles will give you hand issues later in life? Oh my gosh, yes, we need to put this thing to bed. There hasn't actually been any evidence that doing this excessively will cause arthritis. There was even a physician that did an experiment on himself where he cracked his knuckles for 60 years and showed no evidence of bad arthritis or injury to the hand. Caveat, you can cause injury if you're not doing it correctly, but, will all of these things cause major issues just from that popping mechanism? No. All right, question number 10. If air got under skin and made human bloat, is there a balloon syndrome for the human body? There is something called aerophagy, which basically is excess swallowing and ingestion of airs. But there's the other component. Usually it's trauma and injuries, where if there's a cut, you can get some air into the skin itself. I see people who get fractures of the face, where if they sneeze, the air shoots up into the skin and dissects the skin, and we call that subcutaneous emphysema. So there is a huge spectrum of what could cause air within your skin. All right, question number 11. Does it affect your health to be a cannibal? Yes. So cannibalism is basically eating one's own species. So, humans are pretty much hardwired not to do that. Now, obviously, there's also the health components. If you end up eating another human's brain, there's a disease called Kuru that is similar to mad cow disease. And it has to do with the prions that are in the brain that can then actually cause you to be really sick, start trembling, and then actually could lead to your own death. So no, nobody in the human species should be eating another human being. All right, question number 12. I sneeze so hard that it feels like my insides are hurting. My lungs is burning up, my neck is swollen up. Is it a side effect of my allergies, or is there something really wrong with my body? Sneezing is a reflex that we have in our body and is trying to expel whatever is causing the irritation. But be careful if you're sneezing really, really hard. You can have muscle strains and you can actually cause tears within your tissue. You can actually cause a pneumothorax sometimes, have a collapsed lung because of it. The other thing is you can have irritation of your lung lining, which is called pleurisy. It's multifactorial. It's really hard to kind of narrow that down, but it is definitely something that needs to be addressed if you continue to have these types of symptoms. Is it true you could die from pushing too hard on the toilet? Yes. What I'm talking about here is something called a Valsalva maneuver, where you actually pass out. When somebody's pushing really hard, you're contracting really hard in your abdomen and your chest, and you're not really breathing, and that's when the vessels pop out. And what's happening is you're increasing intrathoracic pressure, which basically has to do with vagal or lack of vagal stimulation to slow down your heart. But what could happen is you slow it down so much that you don't have enough blood flow going to your brain and you pass out. Pass out because of the Valsalva maneuver, and you go into an abnormal cardiac rhythm, which if it's not corrected right away could lead to cardiac death, as well as if you just pass out and you fall and crack your head, you can die that way. So in general, you're not going to hurt yourself, but you should not be straining to go to the bathroom. It should be smooth, it should be easy, it should not be hard. If you have abnormal stool patterns, maybe talk to your doctor about it. Hi, I have a problem. I just turned 20 recently and I just stopped growing. Everyone in my family, excluding me, is tall. I have also been diagnosed with hyperthyroidism recently, but I need to know, is there a way to grow my height? Well, yes, but if everybody else in your family is tall and then you unexpectedly stopped growing, maybe there's something that you need to look into. Maybe there's a hormonal imbalance. Now, you mentioned that there's hyperthyroidism. Hyperthyroidism is related to the thyroid gland that's here in your neck. There people could be hyper or hypo. Hyper means it's overactive, producing too much thyroid hormone. What happens is when you have hyperthyroidism, it increases your metabolic state, which then could accelerate within your growth plates the closure of them, leading to decrease in bone growth, and then thus you stop growing. So it's something you need to talk to your doctor about and address. There are medications that somebody would go on if they have hyperthyroidism, and it has to do with down-regulating it, and there's multiple different medications. But talk to your primary care doctor and maybe get them to see a specialist, somebody called an endocrinologist, somebody who deals with hormones of our body. Are there any studies suggesting that people who work night shifts are at a higher risk of developing cancer? Unfortunately, there are. So basically, when people work overnight, what happens is it's disrupting your circadian rhythm. And so during the time that we're sleeping, having DNA repair, cellular cleanup, your sleep-wake cycle is disrupted or not on appropriate patterns. Your ability to repair your DNA when there might be an error, which occasionally happens, might be impaired, thus increasing your risk of cancer. What we'll end up doing is we'll put down a couple studies in the description below that would give you examples of this and the studies that they have done. Is it healthier to ejaculate regularly, or doing things like No Nut November have benefits? I've always heard more is better.
Is that a hair gel?
First, I'm going to say more is not always better. But what is No Nut November? For anybody who doesn't know, basically, it's a time period challenge of no ejaculation during this time period. Are there health benefits to it? Better sleep, more mental clarity, and maybe increased amount of testosterone. But if people don't ejaculate, you do have a buildup of sperm, and so your body might actually have more nocturnal emissions, so nighttime ejaculations when you're sleeping, to have that turnover because you continue to make sperm every single day. So to answer the question, it's really a personal choice of what you want to do. Are you going to cause harm one way or the other? Not necessarily. If you're having any questions relating to your own personal health, talk to your healthcare provider. How can a tick bite make a person unable to eat red meat anymore? Is it permanent? Yes, because some ticks, some more than others, like the Lone Star tick, they release a molecule called alpha-gal. And so this is a type of sugar molecule that our bodies end up actually reacting to, and reacting as if it's foreign, which leads to an allergic type reaction and can lead to anaphylactic reaction. And so this molecule is found in red meats. And so that is why when individuals, after they've gotten bitten by a tick, potentially have this syndrome where they can't eat red meat because they develop an allergic type reaction, can last a few months or several years. Is it true that stress actually shrinks the brain? Yes, but very specifically in the area of the hippocampus of your brain, what has to do with memory, where the hippocampus goes through a process called neurogenesis, where it's like making new connections in the neurons. When you have increased stress in your body, you release an increased amount of cortisol, and cortisol inhibits neurogenesis, thus almost inactivating your hippocampus, thus shrinking it. So avoid that chronic stress and make sure that you're doing things to release the stress out of your body. And you're looking for calm vibes, I formulated a supplement called Chillax. It's got niacin, calcium, magnesium, L-theanine, saffron. It will positively help your mood and support the occasional life stresses. So definitely check it out at lifehappens.com or on Amazon. What would happen if your entire tongue was cut out in, say, an accident? Life would be pretty hard, but still able to function. Your tongue is for speech, taste, articulation, controlling saliva, expression, multiple different things. And so if you don't have that, you're going to have a really difficult time. It's a very highly specialized and large muscle. So then you think, okay, can you have a transplant of a tongue? I haven't seen that or heard of it because this would be a rare event, but medical science is wonderful and always evolving, but it could be quite complex to try to get a muscle into you're reconnected into your nervous system, so that way you'd be able to have it function appropriately with your brain. So I see it as quite difficult, but maybe it's possible. If you drink coffee or alcohol but want to feel the effects faster, like if you want to get drunk faster, should you shoot it up your butt with a turkey baster? Are there any benefits of this? Thanks for humoring my curiosity, doc. I do not recommend it. Because of the rectal tissue and the vessels that are down there, what ends up happening is it has to do with like a first and second pass going to your liver. So it goes directly into your bloodstream, bypassing your digestive system. Very risky. Lot of consequences, could be toxic, could be fatal because of the quick absorption, and again how the alcohol gets absorbed into the body, and just the dangers of increased risk of perforation of your bowel, as well as the irritation of the alcohol in that area. So at the end of the day, please, if you're going to use coffee or alcohol, just ingest at the normal end and not the other end. Curious question, should you floss before brushing your teeth or after? I've always flossed after, but now reconsidering which is the better way to live. Flossing your teeth allows you to break up the debris between your teeth, get any food particles out of there, move any of the debris that's been left over, and allowing any fluoride to get in there. And some dentists may debate this, and if you do floss, make sure that you floss before brushing your teeth. But in general, this is the recommendation. Do you guys floss before or after brushing your teeth? Let me know in the comments. I got sick and I didn't lose my sense of taste, but my sense of taste changed drastically. Like coffee started tasting too sweet and gross, and while I used to love spicy foods, it's too spicy for me now. What the heck? How does that happen that your taste buds just change? Well, it's a great question, and sorry, hopefully it comes back. When you get sick, your sense of taste and smell does potentially change. It has to do with like your taste buds as well as your olfactory system, so your smell. And it has to do with the fact that you're congested and it's interfering with the nerve impulses and transmission. So if your nasal passages are congested or swollen or inflamed, it can drastically change how your body interprets the food or the smells. Let me know in the comments if any of you have experienced the change of taste and smell after getting an illness. I recently started getting eye floaters. What are they exactly, and am I going blind? When people say eye floaters, usually they see something like black moving in their vision, but like a small piece, and then they look at it, it kind of moves away. It's actually these solid pieces of it that are kind of breaking off and liquefying, and so you're seeing the reflection as it breaks off and changes. If you have almost like a curtain coming down, that is concerning for a retinal detachment, and you need to see an ophthalmologist ASAP within 24 hours, and they can do lasers to tack it back up. In general, if you have anything new eye abnormality, your eyes are so specialized, go get checked out, and that way you can have a professional who does this for a living look at your eye, look in the eye, and tell you what it is. It needs to get checked out ASAP. I had a friend go in for a colonoscopy and they came out and couldn't speak for months because the tube or whatever they used to sedate them messed up their vocal cords. How does this happen? When you're typically having a colonoscopy or an endoscopy, you don't necessarily need to be intubated. Intubation is when we put a breathing tube through your vocal cords and a tube sits right there. That could cause irritation to the vocal cords and can cause issues to individuals when it comes to talking, but it should come back. The vocal cords are muscles, and so if there's any medications relating to, weakening the muscles or irritating, that could happen as well. Other reasons would be if there's like a polyp on there, if you're a singer, if there's an infection or a virus, that can cause that as well. So in severe cases, you could have vocal cord paralysis or damage, and this needs to be seen and evaluated by an ear, nose, and throat doctor. Hypothetically speaking, can someone internally combust? We are very awesome, great specimens. We cannot just internally combust. We can't just explode from the inside. Everything fall apart? No, our bodies don't work that way. Can popping a pimple in the danger triangle of your face really kill you? Actually, yes. And why is it dangerous? It's dangerous because things in this area could then track into your cavernous sinus within your brain. And so it can increase the risk of cavernous sinus thrombosis, which is a clot in the brain, which then could kill you. So basically, it's an infection from the popping of these pimples that spreads inward into the face, into this cavernous sinus, which is very hard to diagnose because you need an MRV. You need a doctor to very specifically be looking for this in these diagnoses. It's not a common study that is done. How does being cryogenically frozen work? Do you think they will ever be able to bring back people who did that in the future?
It's freezing in here, Mr. Biggles.
Interesting question. So cryogenically being frozen is when you actually cool somebody's body down to like super extreme cold temperatures. This is done after they have died, but I guess the idea is then maybe if there was a medical issue or a really great medical technology that you can then thaw that individual and revive them from whatever killed them. I'm not sure it's going to work. So the body is stored for extreme cold temperatures. Do you guys out there want to be cryogenically frozen? Let me know in the comments.